Welcome to our presentation. I'm Judy Rees. I'm a physician epidemiologist at Dartmouth College, and I oversee data collection at the New Hampshire State Cancer Registry. I also oversee the Dartmouth Cancer Centre's Community Outreach and Engagement team. Through these two roles, I've worked on several projects with our partners at the state, who you'll meet now. I'd like to introduce my co-host, Robert Thistle, the Principal Investigator of the APPLETREE Program within the New Hampshire Department of Environmental Services, and Karen Kraver, Administrator of the Environmental Health Program at the New Hampshire Department of Environmental Services. Today's training is about the New Hampshire Environmental Health Guide, which is a new resource we've put together to help you find information on environmental health issues in New Hampshire. We're going to talk about these 4 areas. The topic areas in the guide were identified by stakeholders as areas of interest and need. There are staff in multiple agencies within the state's infrastructure, and those staff want to help you answer the questions raised by your community. We'll talk about how to navigate through the topic areas in the guide, and we'll discuss other resources available to you, for example, from federal agencies. The Environmental Health Resource Guide was created to help you quickly find answers to questions from community members. We want to give you fast, easy access to resources to avoid lengthy searches to find what you need to answer questions from the public quickly. Most importantly, a guide is only useful if the resources are the right ones to help you problem solve.
Thanks, Judy. And hello, everybody. My name is Rob, and as Judy mentioned, I'm the PI for the APPLETREE team in New Hampshire. So what is APPLETREE? I'll spare you the acronym for now, but it's a state program that aims to reduce environmental exposures through local efforts. And the program is really a partnership pulling together various organizations for this collaborative effort. That's conceptualized here by these gears representing the organizations that all have to sort of turn and coordinate together. And I should pause to note that the funding for this and other projects that drive improvement in public health was provided through APPLETREE's grant. And now, what organizations are partners to APPLETREE, and how does this partnership work? So I like to think of APPLETREE as a bridge between the Department of Environmental Services, shown here on the left, and the Department of Health and Human Services, shown here on the right. While there are different topic areas that these departments cover in New Hampshire, examples are listed here, APPLETREE pulls these together from across these 2 departments. And what this does is enable us to use a kind of broad range of tools and a broad range of subject matter experts in order to help New Hampshire residents and their respective communities.
I'm going to share some of the major areas of expertise available to you. One partner that APPLETREE includes is New Hampshire's Department of Environmental Services. The Department of Environmental Services includes 3 divisions: Air Resources, Waste Management, and the Water Division. The Environmental Health Program works across these divisions. Another APPLETREE partner is the Division of Public Health Services within New Hampshire's Department of Health and Human Services. Within the Division of Public Health Services, there are several areas available to you for assistance. It's likely that you would be interacting most with infectious disease control, lab services, public health information, public health protection, and population health and community services. You might also engage with the Office of Legal and Regulatory Services. The APPLETREE program works across departments. In the guide we developed, you'll see how these different departments, divisions, and programs are available to provide support and answer questions in content areas such as air quality, drinking water quality, health concerns, and other concerns raised by members of your community.
We've developed this guide to help you quickly find the right resources for your situation. Let's review an everyday example of how you might use this guide. Your office receives a call from someone who just moved to New Hampshire, and their neighbour has told them about arsenic in well water, and they want to learn more. Start on the left and read across the guide. Using this example, the main topic area or concern is drinking water quality. Reading right across columns, the level of detail becomes more focused. The caller is specifically asking about well water, which you'll find under the second category. Links related to chemical contaminants are in the third specific concern column, which directs you to the best local resources to start with to most efficiently answer your question. In this example, you'll land on these two websites. Is There Arsenic in Your Drinking Water and Arsenic and You, both good places to start people off on the right track. The final two columns are additional state resources and additional federal resources which provide more information or a deeper dive into the topic for anyone who wants to learn more. As another example, if someone was interested in testing their home air for radon, here the concern is air quality, and the guide will take you quickly to indoor air quality and then radon testing. And here you'll find a place to order a free radon test kit, which should make you very popular with the person you're trying to help, as well as more information from state and federal agencies. These are the agencies listed in the guide. As you can see, there are a lot of agencies and partners available to help you. There are real people in these agencies and they love getting questions from the community, so please make use of them. APPLETREE, DHHS and Dartmouth are developing 2 additional trainings for you where New Hampshire experts will dive deeper into understanding cancer concerns and environmental contamination. Cancer concerns in the community will review what cancer and cancer clusters are, how cancer concerns are investigated in New Hampshire, and your role. And then a later training on understanding environmental contamination and risk will review what contamination is, its risk to health, and risk communication and perception. Check with the New Hampshire DES website for updates on future training opportunities. For questions at any time, please visit the websites found in the introduction section of the guide or contact APPLETREE Principal Investigator Robert Thistle. We truly appreciate your support of New Hampshire communities and we want to provide you with any support that you need in your role. Thank you. Now let's have introductions by the staff themselves from the New Hampshire Department of Environmental Services and the New Hampshire Division of Public Health Services. They're all here to help you.
Hi everyone, I'm Dr. Robert Thistle. I'm the Principal Investigator for the APPLETREE Cooperative Agreement here at the Department of Environmental Services in New Hampshire. And classically, I'm a trained scientist. I'm a molecular and cell biologist. And my role here is really to partner with local communities and help them figure out how they can reduce environmental exposures in their daily lives. We accomplish this through health-based recommendations. And I'm thrilled to be joined by you today, and I look forward to partnering with you in the future.
Hi everyone, my name is Kraver and I'm the Environmental Health Program Administrator and Environmental Justice Coordinator at the New Hampshire Department of Environmental Services. I manage a team with experience and expertise in health risk assessment, toxicology, epidemiology, and health education and communication. We have lots of combined experience in responding to community concerns, and I'm just one of the many people here to help you. Just reach out and ask. Thank you for joining us today, and we look forward to supporting you in the future.
Hi, my name is Whitney Hammond and I'm the Chronic Disease Director at the Division of Public Health Services. And in that role, I lead a team of people who are responsible for helping respond to concerns about cancer in the community and concerns about potential cancer clusters. So I wanted to thank you for being here. Thank you for all of the work that you do and say I look forward to continuing to work with you in the future.
Hi, I'm Lori Reardon. I serve as the health educator within the APPLETREE team. And I'm also the Environmental Health Coordinator within the Division of Public Health Services at the Department of Health and Human Services. I specialize in community engagement and risk communication, and I look forward to supporting you, helping you, and working with you to improve environmental public health in New Hampshire.
Hi, my name is Amy Hudnor, and I'm the Private Well Coordinator at the New Hampshire Department of Environmental Services. I work in New Hampshire communities across the state, educating private well users on how to test and treat their water for common contaminants. Please feel free to contact me about how we might collaborate to bring private well resources to your community.
My name is Mary Beto, and I am a health risk assessor in the Environmental Health Program at New Hampshire Department of Environmental Services. My expertise is in chemical hazard research and exposure assessment, in particular with regard to development and review of ambient groundwater quality standards. I'm one of the many people here to help you address your community concerns. Our team looks forward to working with you in the future.